Prepare the following materials when using an oxygen tent: an oxygen source and flow meter, oxygen extension tubing, an appropriate size clear plastic Ziploc bag or e-collar tent. An e-collar tent with tubing requiring no assembly can be purchased from Jorvet Incorporated and is called the OxyHood, as shown here. If the OxyHood is not available, an e-collar tent can be made by assembling a plastic e-collar and covering at least 80% of the front using clear sandwich wrap attached with clear packaging tape around the edges. We will begin with the use of a Ziploc bag as an oxygen tent. Connect one end of the oxygen tubing to the flow meter and set flow to 0.2 to 0.5 liters per kilogram per minute. Larger animals will require a higher flow rate. The oxygen tubing passes into the bag through the same opening the animal's head enters the bag. It may be necessary to tape the tube to the bag. Place the bag over the patient's head and neck. It should be large enough for several breath exchanges to occur without depleting the air in the bag. It is very important that the dorsal corner should be cut off to allow expired carbon dioxide to escape. The bag can be partially closed to better hold it in place. This technique is tolerated fairly well, especially in cats. If using an e-collar tent, position the open area of the mask at the top to allow expired carbon dioxide to escape. Place the open end of the oxygen extension tubing into the tent, entering the tent from the neck end. Secure the tubing along the ventral aspect of the tent using packaging tape, with the open end in front of the patient's mouth and nose. Ensure that the patient's nose does not become occluded with the front of the tent, which could result in suffocation. This technique allows oxygen to be administered to the patient at relatively high percentages while simultaneously allowing physical access to the patient. Administer this temporary oxygen as directed by the attending veterinarian. Except for the e-collar tent, all of these techniques require the presence of another person to hold the oxygen delivery tubing. Therefore, they are best used during the resuscitation period only. Long-term oxygen supplementation is best provided using the e-collar tent or oxygen cage in small animals or nasal catheters in small and large animals. These latter techniques will be discussed further in Part 2 of this program. An important consideration to keep in mind with the use of oxygen masks, tents, or cages is the risk of overheating. Close monitoring of the temperature inside the mask or tent, as well as the animal's body temperature, is necessary. If overheating occurs, the flow rate must be increased, or an alternative technique for oxygen supplementation used. Consult the attending veterinarian if overheating occurs. There are no special techniques or concerns during discontinuation of oxygen supplementation using flow-by, tent, or nasal prongs. Be sure to clean all equipment after each use.